Hi, my name is Mark Mintline, and I'm an oral and maxillofacial pathologist, and I would like to talk to you today about cemento-osseous dysplasia. Cemento-osseous dysplasia is a non-neoplastic fibro-osseous lesion of the tooth-bearing regions of the jaws. It is the most common benign fibrous osseous lesion of the gnathic bones and is often diagnosed by dentists clinically. Typically, these lesions are non-expansile, but florid cases are an exception. Cemento-osseous dysplasia is most common in Black females, but can be found in other races and ethnicities. Traditionally, cemento-osseous dysplasia is divided into three variants based on anatomic location. Periapical cemento-osseous dysplasia, which is associated with mandibular anterior teeth. Focal cemento-osseous dysplasia, which is associated with a single tooth or site. And florid cemento-osseous dysplasia, which has multifocal or multi-quadrant involvement. Ideally, cemento-osseous dysplasia is identified based on clinical and radiographic features. Most periapical and florid cases are diagnosed without a biopsy. However, features of focal cemento-osseous dysplasia may be less specific. Radiographic examination of cemento-osseous dysplasia is essential. Lesions can be radiolucent, mixed, or radiodense, depending on maturity. Here is an example of periapical cemento-osseous dysplasia with increased calcifications. The lesions are associated with vital teeth, and the lesions are well defined with a radiolucent rim. Occasionally, radiolucent lesions are mistaken for odontogenic inflammatory lesions, and clinicians unfortunately endodontically treat them. To reiterate, cemento-osseous dysplasia is associated with vital teeth. Focal cemento-osseous dysplasia is associated with a single site. Over time, the lesion shows increased density as it matures. Serial radiographs are incredibly helpful to diagnose and monitor lesions. Once a case of periapical or focal cemento-osseous dysplasia has been established, they can be monitored at routine dental appointments. Here is an example of cemento-osseous dysplasia associated with an edentulous site. Florid cemento-osseous dysplasia is associated with multifocal or multi-quadrant involvement. Individual lesions may be radiolucent, mixed, or radiodense. Florid cases may present as expansile lesions and present with pain secondary to infection. Florid cases may require closer clinical follow-up for complications of osteomyelitis. As a clinician, it is important to recognize that areas of cemento-osseous dysplasia do not behave like normal bone. The alveolar bone in areas of cemento-osseous dysplasia tend to be hypovascular and prone to necrosis and secondary inflammation. Dental implants in areas of cemento-osseous dysplasia are not recommended. Trauma, including biopsies and extractions, may expose sclerotic masses to the oral cavity. There are a few clinical scenarios where it is appropriate to biopsy these lesions and establish a diagnosis. Focal cases that tend to be less specific, especially when they are radiolucent, may need to be biopsied. In florid cases, a biopsy should be considered if there are cystic changes. Lastly, cases with secondary osteomyelitis or a superimposed odontogenic inflammatory lesion may need to be biopsied. Here is an example of florid cemento-osseous dysplasia with simple bone cyst-like changes. All the clinical variants of cemento-osseous dysplasia have similar histologic features. Cemento-osseous dysplasia is characterized by a loose fibrous stroma with varying degrees of osteoid, bone, and cementum-like particles. Often during surgery, cemento-osseous dysplasia is curetted into small, gritty pieces. The tissue is comprised of a benign fibrous stroma with vascularity and round, cementum-like pieces of bone. Cemento-osseous dysplasia can contain a variety of mineralized tissues, including bony trabeculae, osteoid, and cementum-like particles. Over time, as the lesion matures, the mineralized tissue can coalesce and form large sclerotic masses. This concludes a review of cemento-osseous dysplasia. Thank you.